So with the bitterly cold condition we've been experiencing, even with the best of efforts, some people are going to experience frostbite.
Yeah, so someone either thinks they have it perhaps or don't know exactly what to do. We're bringing in Dr. McGeorge to kind of find out exactly what do you do. I mean, do you actually go to the ER if you think you may have this, or how do you handle it?
It kind of depends on the circumstance. You know, this time of year, basically, we do actually see these kinds of injuries pretty consistently, especially when it's this cold. But, you know, frankly, anytime the wind chills are consistently below freezing, we see cold injuries, particularly in the homeless population. Fact is, when it's this cold, homeless or not, frostbite is going to occur, and there are some important things to consider when you treat it.
By the time you hit true frostbite, when you're damaging the tissues of your body, things are typically numb, so you don't necessarily feel them.
There are stages before numbness sets in, though, and the sooner you recognize them and begin rewarming, the less damage there will be. Especially vulnerable areas are the ears, the nose, the fingers, and toes. As they become more injured, you'll usually notice a cold, tingling sensation or even a burning feeling as the nerves become injured. Signs of injury include a white or grayish-yellow skin area, skin that feels unusually firm or waxy, and numbness. As soon as you feel an area becoming painful, you should warm it up. Numbness is a sign damage has begun. Now, there are obvious things you should do. Remove any damp or wet clothing, get out of the cold, and cover the area with warm, dry clothes. The best way to rewarm fingers and toes is running under or soaking in lukewarm water, not hot. Water that's too hot can cause more damage.
Make sure that you have somebody else that's kind of testing the temperature of the water, because you don't want to scald yourself and you may not have all of your sensation.
Also, a fireplace or a hot surface like a radiator or heating blanket may seem like a good idea, but they're not, because of the burn risk when you don't have good sensation.
Now, as you rewarm an area, it is normal for it to become red and even painful as circulation returns. If that happens, you should double check that your water isn't too hot, and you can use an area that hasn't been frozen, like maybe your elbow, to check the water. Now, once you've rewarmed the area, if the sensation returns to normal and the skin is not discolored or blistered, you don't need to see a doctor. But if the area remains numb, painful, or is darkened or blistered, you should see a doctor, since those are all signs of deeper damage.
So if it's serious, then how do they treat frostbite?
Well, so interestingly, frostbite is actually treated kind of like a burn. Blistered areas, they may heal reasonably well with some careful skin care, but in more severe cases with deeper tissue damage, surgery may actually be necessary, like skin grafts. And incidentally, areas that have been frostbitten in the past, even mild frostbite, they are going to be much more sensitive to cold in the future, and you should keep that in mind. If you've had frostbite in the past, you need to protect those areas of the skin even more.
Wow. Thanks, Doc.